Well, hey everybody, this is Robert and welcome to Outbreak News TV. And today, on this video, I want to go ahead and take a look at Russia and their situation with COVID. The numbers have increased by about 30% over the past week, so they have leapfrogged a bunch of countries. Now they are ranked number 2 in the world. And then there's the question of fatalities, and that's something we're going to look at today. But if we take a look at this from the Russian Ministry of Health, here's their official numbers, and number of confirmed cases now are 281,752. And the number of deaths, I want to lift this up in case my head's in the way. Hopefully you can see it. It's 2,631, and that's been the big question. So we're talking about less than 1% case fatality in Russia. But I do want to look at I want to take a look at the major city in Russia, Moscow, right? Moscow's total cases, 142,824. So that's more than half of the country's total. So it's a big issue going on in Moscow as we speak. Other regions are somewhat smaller. St. Petersburg, only a little over 10,000. So clearly Moscow is the big source of cases for Russia as we speak. And here's a CNN article, and it says coronavirus has devastated Moscow. Now it's spreading across Russia's 11 time zones to ill-funded regions. So Russia hit a grim COVID-19 milestone this week. It's now second in the world, as I mentioned, and it gives the colony counts, or the case counts. But the virus is now spreading across Russia's regions, an enormous landmass that covers 11 time zones and includes some of the country's most remote and impoverished places. In a video conferencing call last week, Vladimir Putin said that the burden would fall on local leaders to decide whether to continue lockdown measures or to begin cautiously lifting restrictions to reopen the economy. We have a big country, he said. The epidemiological situation varies across the regions. We factored this in before, and now at this next stage, we have to act even more specifically and carefully. And then we go on to, this is from Moscow Today, and today's date, 3 things you need to know today. It says Russia confirmed 9,709 new coronavirus infections Sunday, bringing it to the current total. Sunday statistics prompted the head of Russia's public health watchdog to say the spread of the virus has stabilized across the whole country. Number 2, clinics in Moscow, the epicenter of Russia's coronavirus epidemic, will begin mass random testing of residents for coronavirus antibodies on Friday, the mayor said. And number 3, more than 60% of deaths among Moscow's coronavirus patients are not being counted toward the city's official virus death toll, according to city health officials. And again, that goes to the main topic of today's video, is the death toll in Russia. And this Bloomberg report, which is about 4 days old, and they really do, and they title this, Experts Question Russian Data on COVID-19 Death Toll. And this kind of gets to the crux of everything. So we have this surging coronavirus outbreak going on in Russia, making it a global hotspot. One thing puzzles health experts. Why is it reporting so few deaths? And they say that the World Health Organization said it's in talks with Russia about the country's statistics for coronavirus deaths, which at 0.9% is far below the global average and the lowest among nations with the highest number of infections. Quote, we at the World Health Organization are closely discussing this with Russian authorities, said Melita Vujnovic, the organization's chief representative in Russia. She said in a phone interview last week. They are looking at the entire mortality to see if something has been missed. Vujicic told Russian state TV on Wednesday she doesn't believe the authorities are deliberately downplaying the mortality rate, but a recalculation of the death toll may happen. The health ministry didn't respond to requests for comment on this article. So let's go ahead and... So this is what the World Health Organization put out on April 16th, so 1 month ago. The International Guidelines for Certification and Classification of COVID-19 as a Cause of Death. And if you go through it, it's kind of a complicated document, but here's your definition. A death due to COVID-19 is defined for surveillance purposes as a death resulting from a clinically compatible illness in a probable or confirmed COVID-19 case, unless there is a clear alternative cause of death that cannot be related to COVID disease, for example, trauma. There should be no period of complete recovery from COVID-19 between illness and death. A death due to COVID-19 may not be attributed to another disease, for example, like cancer, and should be counted independently of pre-existing conditions that are suspected of triggering a severe course of COVID-19. And it goes through and it gives a bunch of examples and chain of events. Like I said, it's sort of a complicated document to go through. And most of these examples of chain of events for the fatality are leading to COVID. Then you have examples where cause of death, hypovolemic shock due to aortic dissection, due to motor vehicle accident. Of course, that's not a COVID-19 death, and hopefully nobody will be calling it that. But it appears like the only things in here that they call not a COVID-19 death are things that are super, super obvious. Cause of death, heart failure due to myocardial infarction. That's the cause of death, so not a COVID-19 death. But some of the other ones, it says here, acute respiratory disease distress syndrome due to pneumonia due to suspected COVID-19. So that individual gets COVID-19 as the cause of death. I don't know. So what do you think about that? And let me go ahead and talk about what Russia had to say about the low numbers. And this is from a Moscow Times report from Thursday, May 14th. Russia is boasting about low coronavirus deaths. The numbers are deceiving. All right, so let's take a look at what it says. Varying methods. While the World Health Organization published complicated guidelines for classifying coronavirus deaths, experts complained that they arrived late in the pandemic on April 16th, when many countries had already made their own decisions on categorization. Plus, experts said some countries had by then already counted the bulk of their deaths. Belgium adopted the most liberal method for classifying coronavirus deaths. To take one example, the country records coronavirus deaths in nursing homes even if the virus was only suspected in the deceased, not confirmed. Unsurprisingly, its coronavirus mortality rate is the highest in the world. Meanwhile, Italy and the United States, as well as many European countries, automatically classify deaths as caused by the coronavirus if the deceased test positive. Now, Russia falls into a more conservative end of the spectrum. The country has continued relying on traditional methods of determining the underlying cause of death that sees it carry out autopsies in up to 70% of deaths compared to about 10% in many European countries. According to Sergei Timonin, a demographer with the Higher School of Economics. According to health ministry guidelines, quote, in the absence of clinical manifestations and pathological changes, especially in the lungs, as a result of the virus, COVID-19 is not listed as the cause of death. Put another way, if a person has a brain hemorrhage after earlier testing positive for coronavirus, the cause of death will be classified as hemorrhage, not COVID-19. So, there's where we may see the differences. the high rate of autopsies being performed on deaths in Russia as compared to other countries maybe, and their guidelines may be the reason why we're seeing such a low percentage as compared to other countries with such a high number of cases. So just found that very interesting, and I thought you might be interested also. Let me know what you think. Go ahead and comment below. Is Russia doing it right? Is everybody else doing it right? Is it somewhere in between? I'd love to hear more about it. And let me know what you think. Comment below. Subscribe to the channel. Share it with your friends. And I'll see you next time on Outbreak News TV.